Hi, good evening. My name is Vanessa, and I am a nurse practitioner student at Baylor, and I'm going to be doing your assessment today. Do you have any questions? Okay, so I'm going to go ahead and wash my hands before starting. Okay, so first thing is I want to note his overall appearance. So he is well groomed, has good hygiene. He's not showing any signs of respiratory distress or pain. He's able to make eye contact appropriately and answer questions. So we're going to go ahead and move on to his skin. Skin is dry and intact, warm. He has tattoos on his arms bilaterally. Check your nails, please. Capillary refill is brisk in under 3 seconds. No pallor, cyanosis, or jaundice noted. Now I'm going to go ahead and move on to his head. So feeling around his head, there's no bumps noted. It's atraumatic and normal cephalic. Okay. Now I'm going to go ahead and test cranial nerve number 7. So we're going to check his facial muscles. So I'm going to have you wrinkle your forehead. I'm going to have you frown. Smile with your teeth. Puff out your cheeks. Make a puff. Okay, so cranial nerve number 7 is intact. Now we're going to move on to cranial nerve number 5, which is the trigeminal. So we're going to have you open your mouth. I'm going to have you bite down. No popping or clicking is noted. Does it hurt when you bite down?
No.
So TMJ is negative. Now we're going to go ahead and move on to his eyes. So looking at his eyes, they're even. Eyebrows are symmetrical. There's no crust on his eyelashes. His corneas are translucent. Scleras are white. Conjunctive eyes are pink. So no problems there. Now we're going to go ahead and test cranial nerves number 3, 4, and 6.
Okay.
So we're going to go ahead and have you follow my finger, but keep your head straight and just follow with your eyes. Okay, perfect. So now we're going to go ahead and move on to his pupil assessment. Okay, so I'm going to shine this light into your eye. Pupils are equal and reactive at 3 millimeters. I'm going to check direct. So when light is shined in his eyes, it is constricting, and now we're going to check consensual. So when I shine the light in one eye, the other eye should constrict as well. Okay, perfect. So they both follow. Now we're going to check accommodation. So I'm going to have you follow my finger. I'm going to check if you can focus on one object, so it's going to get really close to your nose.
Okay.
Okay, perfect. Now we're going to move on to the ophthalmoscope assessment. Okay, so I'm going to go ahead and look into your eyes. So I'm going to rest my hand on here. So looking into his eyes, vessels do not seem to be burst. Macula is seen, yellow and oval. Other eye. Disc is seen. Okay. So eyes look good. Now we're going to go ahead and move on to your ears.
Thanks.
My patient,
Can I turn
let's turn off this one. Okay, so first I'm going to start by looking at your ears. So ears are symmetric bilaterally. There's no lesions, redness, or bumps noted on either. Auditory canals are not blocked. Perfect. Go ahead and check your ears. Okay, so first one is tympanic membrane is seen, pearly and gray, minimal wax. Check your other one. Once again, tympanic membrane is seen, pearly wax in this ear. Bite reflex is present on both ears bilaterally. Now I'm going to go ahead and check your nose. So mucosas are pink, septum is not deviated, and turbinates are not blocking his breathing patterns. Okay, now we're going to go ahead and check your mouth. So looking at your lips, they are moist. I'm going to say open up. Okay. Mucomucosas are pink. Perfect. Good dental hygiene. Perfect. Now I'm going to have you stick your tongue out and we're going to check hypoglossal nerve 12. Okay, so no deviation, and it's symmetrical, no lesions noted. Okay, you can put it back in. Okay, now I'm going to have you say ah. So tonsils are present, not enlarged, uvula rises. Now I'm going to look inside your mouth one more time, okay? And check your palate. Palates are pink and smooth, move up and down appropriately when talking and breathing. Okay, so now we're going to do the gross hearing test. So I'm going to whisper a word in your ear and I'm going to have you repeat it, okay?
Okay. 6.
Okay, and now the other side.
B.
Yes,
Okay.
perfect. So gross hearing is intact. Now we're going to go ahead and move on to your neck. So I'm going to feel, palpate. Symmetrical, even, no nodules present. I'm going to have you swallow. Okay. No nodules present or felt when patient swallows. Okay, now I'm going to move on to filling your lymph nodes. So we're going to start off by going to the occipital lymph nodes, the tonsillar lymph nodes, the post-ocular lymph nodes, the pre-ocular lymph nodes, the submandibular lymph nodes, the submental lymph nodes, the supraclavicular lymph nodes, the supraclavicular lymph nodes. Okay, so lymph nodes are not felt, so no signs of infection are present. Now we're going to go ahead and move on to your neck. So looking at your neck, it's symmetrical, even, no deviation. We're going to check your neck range of motion. So I'm going to have you flex your neck, so down to your chin. Extend, put it back. Perfect. Now go back to the front. Now I'm going to have you rotate, so look side to side. Okay, and now lateral flexion. So I'm going to have you pin to the side and out to the other side. Perfect. Now we're going to go ahead and do the lung assessment. So we're going to grab a stethoscope. So he has a shirt on right now, so we're not able to assess the skin, but looking at this, it looks like chest rises symmetrically. There's even, there's no deviations in the back. Can you sit up straight for me? Okay. Do you have any open wounds or anything on your back? Okay, so skin feels intact. So now we're going to go ahead and listen to his lung sounds. I'm going to have you turn a little bit this way so that camera can see. And take a deep breath. Okay, and now this side. Okay, and again. Okay, and again. Okay, and again. And again. Okay, and again. And again. Okay. Perfect. So lung sounds are clear. We're going to go ahead and percuss. I'm I'm going to go ahead and lift the bed a little bit, so be careful where you're sitting. Okay. And we stay still. So when percussing, sounds are resonant, no abnormal sounds. Okay, now we're going to move to the front. Looking at the front, skin is intact as well. Do you have any wounds or anything present? Okay, I'm going to lift right here. Skin is dry and moist and intact. Okay, now I'm going to go ahead and listen to your lungs movement. Take a breath in. Okay, lung sounds are clear as well. Now we're going to look at you here. Sorry. Looking at your jugular veins, they're flat, no distension noted. I'm going to palpate your carotid arteries. Okay, your brachial. Okay, now your radial. Okay, perfect. Now I'm going to auscultate your carotid arteries as well. Okay, no bruise heard on any of them. Now we're going to look at your precordium, which is the area in front. No thrills or heaves noted. Now we're going to move on to the heart. So I'm going to go ahead and listen to your heart. So we're going to start with the aorta, the pulmonic, the herbs, tricuspid, and then the mitral. Okay, now we're going to go ahead and listen with the diaphragm, the bell. Okay, S1 and S2 are heard. No murmurs noted. Okay, so for the next portion, I'm going to have you lay down flat.
This way?
Yes.
Okay.
Turn here. Okay, so we're going to inspect the stomach. So looking at the stomach, there's no distension noted. It's flat, symmetrical. We're going to go ahead and auscultate vowel sounds. Vowel sounds are present in all four quadrants. We're going to go ahead and percuss. Sounds are dual. Perfect. We're going to go ahead and do some palpation. So let me know if any of this hurts. Doing light palpation first. Do you feel any tenderness? Okay, patient denies any pain. Now we're going to deep palpation. Do you feel any pain? Okay, perfect. So now we're going to check his liver. So liver is non-palpable. Okay, now we're going to check his spleen. So I'm gonna have you take a deep breath in. And nothing there, so you can get it out. Spleen is non-palpable as well. Now we're gonna go ahead and listen to your arteries. Listen to your aortic, your renal, your iliac, and then your femoral, okay, no bruise heard. Now we're gonna have you sit up.
I'm so comfortable.
We have to have you sit up. We're gonna turn you here.
What are we doing?
Okay, I'm gonna check your legs now.
Okay.
So I'll have you lift your pants up a little bit. So looking at his legs, there's no discoloration, no lesions noted. We're gonna have you do this one as well. No lesions noted. We're gonna check his calves for tenderness. Do you feel any tenderness? Okay. I'm gonna go ahead and put this down so that we can see a little better.
You're leaving these exposed?
Yes. I'm gonna have you scoot back a little bit so that your legs are moving here. Okay, perfect. Now we're gonna check for edema. No edema is present. We're gonna go ahead and feel for the dorsalis pedis. Pulses. Okay, present at 2+. Present at 2+. I'm gonna check the posterior tibial. Present at 2+. Just so you can see. Present at 2+ as well. Now we're gonna go ahead, and I know you're comfy, but we're gonna have you lay back down.
Can I pull these down?
Yeah, you can put them down.
No, I'm happy to lay down.
Okay. So now we're gonna check your hip range of motion. So we're gonna have you lift your leg up. So you're flexing. Do this one. Flexing. We're gonna have you abduct. So go out. And abduct go in. Abduct come out. Abduct go in. Now we're gonna have you turn your leg internally. Okay, and now external. Okay, same with this one. Internal. And then external, out. Okay, now I'm gonna have you pick them up again. So flex. We're gonna have you extend. Flex and extend. Perfect. Now I'm gonna have you push again. So push your leg up. Perfect. And now the other one. Perfect. Now we're going to check your knees. So we're going to have you lift your knee up. So in, so flex and extend. Flex and extend. Now you push up. Perfect. And push again. Perfect. Now we're going to go ahead and move to your ankles. So we're going to have you flex and extend both. Perfect. And now can you move them in a circle? Okay, perfect. And now I'm going to have you push against. And now the other way. This way. And then the other way. Perfect. Now I'm going to have you sit up. I'm going to check your trapezius motor strength. So I'm going to have you put your arms. So I'm going to have you push up against my arms. Okay, now push against. And now push against the other way. Perfect. Now I'm going to check your fingers. Nope, you can see your fingers. No deformities, no deviations, no lesions. They all look good. So now we're going to have you abduct. So open your fingers. And now abduct. Okay, so this is pronation. Now we're going to have you do supination. Okay, and now we're going to have you flex your wrist. So go up. And now extend. Go down. And your forearms, we're going to have you flex. Yeah, and then extend. push up. Now push up. Okay, now turn up and push down. And push down. Perfect. So muscle strength in all his arms, or his fingers, wrists, and forearms are 5. Okay, now I'm gonna have you turn over here. Perfect. Okay, now we're gonna move to your reflexes. So I'm gonna grab this. Okay, now I'm going to check your reflexes. So I'm gonna go for your bicep ones first. Keep your arms straight. You might not feel this, but it's okay. Okay, now I'm gonna do your triceps. So you're gonna go like this. Perfect. Okay, now this one. And then your bicep. Okay, now we're going to go to your brachioradialis. So here. Okay, now we're going to go to his patella. Okay, now we're going to go to his Achilles. So the Achilles I'm going to be testing right here. Okay, present and present. Perfect. Now we're going to go ahead and go to your coordination. So I'm going to have you close your eyes and touch your finger to your nose. Perfect. Perfect. And now I'm going to have you do it rapidly. Perfect. Okay, you can stop now. Now I'm going to check your sensation. So I'm going to touch you with a sharp object and then a soft object to see if you can feel it, okay? So I'm going to have you close your eyes. Does it feel sharp or dull?
Sure.
Okay.
It's combo.
Soft or sharp?
Soft. Whoa. That was sharp. Combo. Soft. Sharp. Combo.
Sorry. Soft?
Soft.
Okay.
Hard. Soft. Soft. Sharp. Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp. Soft. Soft. Sharp.
Okay, I'm gonna have you move your arms out. Keep your eyes closed.
Okay. Soft. Soft. Sharp. 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 Soft. Sharp. Soft. Again. Soft. Soft. Sharp. Sharp. Soft.
Okay. Now we're gonna go ahead and do your shoulders. Skip this one. So we're gonna have you push up, push down. Now we're gonna have you move your arms. Okay. So you're abducting and abduct. Now we're gonna have you come up like a U, and now go down and go back up. Perfect. Okay. So now we're going to check your spine. So I'm gonna have you stand up. Let me pull this up really quick. Okay. I'm gonna have you bend forward. Okay, we're gonna check his spine. So no signs of scoliosis. It's even and straight. Perfect. Now you can stand up. We're gonna check your spine range of motion. So I'm gonna have you bend forward. Now extend and go back. Back. Perfect. And now we're gonna have you rotate, so side to side. Other side, okay. And now you're gonna have you do lateral extension, so go tilt and tilt. Perfect. So last assessment is I'm gonna have you stand here, so the camera can see you. Now I'm gonna have you walk to the counter, but heel toe.
Heel toe.
Yes, heel toe. Like walk, heel toe.
Oh, I see.
Perfect, and now walk back. Okay, perfect. So this is the end of our exam. Now you can have snacks.
Yay.
I appreciate you letting me assess you. And do you have any last minute questions?
How
Okay,
did I do?
you did good.
Yay.